Hi, my name is Dr. Chris Arnold of Arnold Family Chiropractic. You're watching this video because you expressed some interest about what it is that we do here in our office. And like most people, you've probably heard some amazing testimonials and stories from either friends, family, co-workers, and some wonderful things that you're looking for to have happen with your health also. But what I've done is created this video to really truly show you what it is that we do here in our office, because we are totally different, totally unique than any other past chiropractic experience you've ever been through or anything that you ever thought of what chiropractic was supposed to be. So I truly want to make sure this is the right place for you and the right place to really get you healthy before we waste any of your time and any of your money. So please watch this video, understand what it is that we do, make sure you answer the questions at the end if you do already have an appointment set up, and I really look forward to helping you and serving you to the best of my abilities. So the first thing I'd like to share with you is a pivotal, life-changing experience that happened to me just a few years ago. This experience totally turned my paradigm, my world, upside down about how I really view and look at a person's health. It's also what propelled me to do what we do in our office, to be something bigger and something better than just a typical chiropractor, but really help people truly be healthy and well. So hopefully by sharing the personal story of our good friends the McDermotts with you, it'll also shift your paradigm and you'll look at your health and wellness in a different way. So this is the McDermotts here, Carolyn, Alyssa, and Gary, one of the most typical American families you'd ever want to meet. This picture was taken just a few years ago on Alyssa's graduation day. And if you can remember back when you graduated or had a child graduate, it's one of the most happiest days as a family. You know, wonderful, a lot of work and accomplishments that get to that point, and you really feel that that child has the world at its heels, that anything can happen. So it was a real shock to all of us to find out just 2 weeks after this picture was taken, Alyssa was diagnosed with pancreatic cancer. And what I want you to do is, by looking at this picture, can you really see how sick she was? And the answer is no. Everyone missed it. Everyone missed it. It wasn't until she got really severely sick. She got sick really quickly and almost died. But luckily they did find it in time, and she was actually able to start some treatments. Put yourself in the shoes of the McDermotts for just a second. What would you do if you had a daughter, young, beautiful daughter that's dying with cancer? What would you do for her? Anything, right? And that's what the McDermotts did. Basically, their world shifted, that they all was about Alyssa. They traveled on the weekends to find her the best doctors. They were giving her treatments. They were working overtime, doing special functions to raise money to help Alyssa. The good news about all this stuff, Alyssa was young enough, healthy enough, that she was actually able to respond, and she was doing very well with the treatments. So my wife and I was just sitting talking one evening, and all of a sudden the phone rang. And you just had that eerie feeling. Has that ever happened to you? Before you pick up the phone, you know it's bad news? Yeah, we both kind of looked at each other, saw who it was. My wife picked it up and she goes, "Yes, she died." "When? What? How?" And I'm on the other side going, "Tell me what's happening," right? She got off the phone and said she had died yesterday. I was like, she was so healthy, she was doing so well. And she says, "No, it wasn't Alyssa, it was Carolyn that passed away." 52 years of age, shows up Monday morning to her office, sits down, talks to her coworker about whatever doctor they went to that weekend, turns around to start her work, and head hits the table, that's it. They jump on her, they try to do CPR, they even call 911, bring in the paddles and give her the paddles, nothing happens. Next thing you know, before even lunchtime, they're putting her in a body bag and wheeling her out. Does it get any worse than that on a Monday morning? The story does continue to get worse, because here's what I also found out is 2 weeks before all this happened, Carolyn was to see her doctor on a regular routine visit. After all the blood work tests, everything came back fine. The doctor looked at her and said, "What? You're totally healthy, you're fine." My question is, how does someone go from being healthy to dead in 2 weeks? It shouldn't happen like that, right? What's sad is this is not the only time this story happens, right? I've told this story to many different people, and every time I tell this story, someone says, "Yeah, I know that. I had an uncle, I had a friend, I've heard of this person, relative, whatever, that they were healthy and then dead in 2 weeks." It shouldn't be like that, right? Something's happening, something's broken with our healthcare system. We need to change. We need to be something bigger and better and different. I will not let any more Carolyns happen. That's what shifted in my life. That's what shifted my paradigm to look and view health in a different way. So what I want to do is kind of file Carolyn's story in the back of your mind, because we're going to go back and revisit here a little bit later, because I want you to clearly understand what happened to Carolyn, because it was 100% preventable, but everyone missed it, even including me, because I wasn't looking for the right thing. So listen on and find out a little bit more about your body, how health works, how we look at things in our office, so you can figure out how you are not going to be the next Carolyn. The purpose of this video is, even if you never step a foot in my office, hopefully this information will help shift your paradigm, your understanding of what you thought healthcare was like, into what it could be and what it should be like, from your current state of poor, ill health, into what your health and life could be like once you really receive abundant health and the secrets to achieving that. So what I want to do is cover 4 key points that I'm going to cover. Point number 1, that there is a difference in healthcare, that not all doctors are created equal, and each doctor has a different system with different intents and purposes. One system we know is failing, and it's actually getting worse every day. Another system is actually improving people's lives, longevity and well-being. And the 4th and main key point is what exactly do we do here at Arnold Family Chiropractic? What is this unique service that we do that no other chiropractor offers? So what I want to first of all focus on is the differences. Most people don't understand that there are different doctors that look and view health in a different way. The 2 types are, 1, there is disease or symptom-centered care, where it's all about treating symptoms and disease. The other one is all about wellness and patient-centered care, and they have each different and distinct intents and purposes. Disease-centered care is characterized by minimizing or eliminating symptoms. Whatever I need to do to get rid of this headache, get rid of this pain, I'm willing to do, right? And it's all about the need to survive, right? Because we're all fearful of dying, right? Doc, do whatever you need to do just so I can live one more day. Or the doctor uses it the other ways. If you don't take this, you're going to die, right? And it's all about doctors being at the peak of this information curve, that basically doctors know best. You know, I've even patients told me that my doctor told me I shouldn't go on the internet because I can become too educated. How can you do that? It's all about being the passive role, right? The patient doesn't know anything, just sits back, and the doctor, what, gives them pills, potions, and lotions to make them all better. The patient's supposed to do nothing. And it's all about being reactive, waiting until a problem shows up, and then we're going to do something to take care of it. A lot of people aren't aware of that there's a second type of healthcare system. It's called wellness care. Specific doctors look and view the body in a different way. They look at what can we do to make this person overall healthy, well, and balanced, not just treating a specific symptom, finding the true underlying cause. What do I need to do to help this patient thrive, whether it's supplements, whether it's drinking water, whether it's exercise, nutrition. Well, all those things are going to not only just help that symptom, but also make them well. It's all about living actively, and the patient knows best. We believe that very strongly, that we need to educate the patient to be in control of their own health, and we also know being proactive. What steps can I do now to prevent issues and diseases 10 years down the road is going to save huge dividends later in life. So if you had to guess which system is working, which system is not working, which system most people choose, and which system most people aren't even aware of, you may or may not be surprised that it is our current medical system that's failing and actually getting worse every single day. But a lot of people might think, well, I thought we had the best healthcare system in the world. Well, we are number 1 in a lot of different things, but maybe not in the right categories. Just like this study showed that in the United States, we spend more money on healthcare than any other country in the world, over $3 trillion, yet our health outcomes are very poor. We rank, used to be 37th, now we're only 39th in the world. There's actually third world nations that are actually healthier, live longer than us. And if you look and have watched, our life expectancy is actually getting shorter. Our kids are going to be the first generation of kids ever that's not going to have as long a lifespan as the parents. They're actually going to live shorter. Shocking, right? And if we actually even look further, this was a wonderful study done by the New England Journal of Medicine by medical doctors that looked at themselves in the mirror and found out, do we help more people or do we hurt more people? And the answer was, it's absolutely the same. In this study, they concluded that we actually spend 1/3 of all of our money on things that actually don't improve our health, actually make things worse, And then we actually end up spending 1/6 of that amount of money to fix the problems that had actually occurred, right? So what do we spend an enormous amount of money on that's not working? To my surprise, one of the biggest things is actually bypass surgery. Here was a study done by medical doctors in the New England Journal of Medicine, actually looked at heart surgery, right? Is it actually working? And they found out 95% of people who had a stent put in, it didn't change their quality of life or extend their life at all. And we know only 2 to 3% of people who have a bypass surgery it actually has any benefit to. Wow! I was shocked, I was amazed. My question is, in any other industry, if something's only 2 to 3% successful, does they still do it? No, it's only in medicine where we just keep doing the same things over and over again that aren't working, and somehow we expect them one day they will work. We also look at drugs. That's another huge thing we spend on that actually do not work. These are just some of the best-selling drugs out of the last 10, 12 years. We know Vioxx and Celebrex was taken off the market after 160,000 people died of heart attacks. Premarin was supposed to help women. It actually caused increased cancer and heart disease. Vytorin was taken off the market after they found out they lied. It actually caused more heart attacks than it actually helped. And we know just in this year, recently here, Advandy was taken off the market. We know Prozac, Zoloft, and Paxil. Again, they found out sugar pills actually help people feel better than these antidepressants. Fosamax, Actonil, and Boniva, these are bone strengthening drugs. They all, we now know, actually increase the risk of hip fractures. Doesn't make sense. We're trying to strengthen bones, but it increases your risk of hip fractures. These drugs are not working. You might say, well, I don't take the big drugs, right? Even things like over-the-counter drugs, which equate to a couple $2 billion worth of sales every year, 20,000 people die of taking just Tylenol and Advil. It causes liver problems, causes your kidneys to shut down. And it's not just taking a bunch of them, it's only taking 1 or 2 of these can actually cause that. The other thing that our healthcare system is really, really good at is creating these new diseases. Every so many years we hear a brand new disease. And this is one of my favorite ones that just came out last year that actually called orthorexuria. And again, I was right out of Time magazine, a copy of this is. And what is it? Orthorexuria is defined as a mental disorder classified as a desire to only eat healthy foods. So my thing of it is if you want to actually be healthy, now you're actually a mental disorder, now you actually need a pill. Is that insane how our system is working? And we know 1 out of every 3 visits to a doctor ends up in a mistake, wrong prescription, misdiagnosis, wrong part operated on, and over 250,000 people die every year from what? Prescription medications. That's a lot of lives. And if you add that up to other mistakes, iatrogenic causes of death, other mistakes caused by the medical profession, there's over 770,000 people die of those causes. If you add those up, the #1 cause of death in our country is our own healthcare system. Is that insane? Most people are scared of flying. The most scary thing you can do is go visit your medical doctor if he's working in the disease care system. Most people I talk to know that this system is not working and is failing miserably, but most people don't know why. Why is this system failing? And it all has to do with the mentality behind it. It all has to do with, let's just say tomorrow morning you wake up and it's the best day you've ever had. You got out of bed, you spring, you have that energy, you have that smile on your face and your body's just totally glowing. First thing through your mind is going to be what? I need to call my doctor, right? No, am I crazy, right? The only time you call your doctor is when? When you're sick, when you have crisis, or when you're diseased. So that's why I call this system is the sick care, symptom care, disease, because you only seek out care, or we're trained or taught to only seek out health care when we're not healthy, which is not the way it should be. These are important services that this system offers, but it's not health care. What is the intent when you go see a doctor? The intent of your doctor to do in the healthcare, in this disease care system, is to what? The detection and treatment of what? A symptom, a disease, or infirmary, right? You go there with a problem, you want to diagnose it, and you want to treat it, right? But the problem with this is the best thing we can hope for in this whole system is to treat the problem when? After it occurs, right? Which is not the best way. And we know relying on symptoms can be very misleading. We just look at a person with cancer, right? Or even heart disease. One of the #1 symptoms that shows up with heart disease is a fatal heart attack. Cancer grows months and years undetected until we have a tumor or something else. So if you're just going by how you feel, is the most inaccurate way of how to grade and judge your health. And we even look at symptoms can be overtreated. Just like take a quick thing like that, if I sneeze, I chew, right? All of a sudden I need to pop a pill or whatever, control it, right? Or is that your body's own innate response to becoming sick, to help your body heal, right? If it's a fever, right? Knock it down, right? No, fever kills germs. If I throw something up, right? Am I really should take the pink stuff to keep it down? No. Sometimes, again, we should be working on our health when we don't have any symptoms. Sometimes when we have symptoms, that's just an outward expression that your body's working and doing what it should be. So symptom care is not working. So just a quick example of how this whole symptom and disease care system works is, let's just say I'm out in my yard working and I trip and fall and all of a sudden there's a nail in the ground and it goes right through my hand. My symptom is what? Ouch, my hand hurts. So I'm taken to the emergency room to see a doctor. The first thing to do, the doctor looks at me and says, so what's wrong? And I said, my hand hurts, I'm in so much pain. Help me with this pain. So the doctor says, well, he never believes what you say, right? Well, we got to run a test, right? Before they can do anything, they got to run a test, right? So they run a test, they do an x-ray, and it comes back, yep, sir, you have a nail in your hand. Thank God they found it, right? So we found out the nail in the hand, but the pain is what your problem is. So I'm going to give you these 2 pills that's going to help with the pain, and I want you to take them, call me in the morning. So I go home, take the 2 pills, call me in the morning. Guess what, doc? My pain's gone, but now all of a sudden I got this red rashed up my arm. All right, great news. We got this great new pink pill that's going to help out with that. Take 2 of these and call me in the morning. So I do that. I wake up the next morning, pain's gone, the rash is gone, but now all of a sudden my stomach doesn't feel very good. Oh no, doc, what's going on now? Here's another symptom. I got to treat another symptom. Guess what? We got these great new blue pills, right? They're going to take care of that problem right lickety-split. So I take 2 of the blue pills, my pain in my stomach all goes away, right? So the next morning I wake up, pain's gone, rash gone, my stomach's gone, but now all of a sudden my lower bowels, I can't move my bowels. They've been stuck. Ah. Doctor says, guess what? We need to operate now. We're going to get serious, right? Isn't that how our healthcare system works? Instead of just pulling out the nail and let my body heal on its own, let's just treat all these symptoms with all these pills and surgeries instead of getting to the underlying cause. You might be thinking like I did for a long time, this doesn't make sense what we're doing to ourselves, right? But it does if you understand how doctors are trained. Remember how we discussed the purpose of a doctor is what? Is to detect and treat disease, right? It has nothing about making people healthy. But if you have a disease, I'm going to detect it and I'm going to destroy or treat that disease. Not the person with the disease, but that disease. Which goes on to show like cancer treatment. Do you know how they measure success in cancer treatment? It's not about longevity or survival. It's all about tumor shrinkage and eliminating cancer. It's even classified as a success treating a tumor if the tumor shrinks but the patient dies. That's why most cancer centers, you'll never hear them talk about longevity or survival rate down the road. It's all about treating that cancer. That's what their mentality is. Same thing with heart disease. It's all about lowering cholesterol, right? But we know 100% of people who take a cholesterol-lowering medication will end up with some type of liver disease and also cognitive decline. Memory issues. I can't remember that, right? That happens to 100% of people. But to a cardiologist, they don't care. I brought down this number. I'm fine with that. We'll let the liver and the brain into someone else's category, right? Because I only focus on this disease. I only focus on this small amount, right? It's not the way we should be looking at our health and well-being, right? Not about just treating disease, but there's a patient with that disease that we need to be working making them healthy. So it makes sense if we have this war on cancer, war on heart disease, war on all these diseases, and we're using some of the most toxic chemicals that we know in this warfare, there's going to be casualties, right? And the casualties are what? You and I's patients, right? So it makes sense to me when I say we apply symptom care, disease-centered care to a healthy population. We're only going to end up with sick, dying, and diseased people. But I got to be honest with you, it's not the doctors and nurses' fault, right? I'm friends with a lot of them, and they're hard-working, dedicated people, but it's the system that they're performing in. The system they're using, the mentality of looking at body and health is totally wrong, and that's why it's failing miserably. Am I the only one who believes that the more pills, potions, and lotions, the more surgeries, the fuller your medicine cabinet is, doesn't make you any healthier? Are you like me who believes there has to be a better way to health and wellness? If that's the case, listen on to the next section where we will describe a system, a way of looking at your body and health in a totally different way that is working, that has wonderful and great results, that can not only help you with your current health issues, but actually make you healthier 10 years from now than what you are today.